Hello, my name is Liliana Ruiz, and today I will be talking about the virtual reality scenario in Unit 4. I will be using patient Veronica Chen, which is a 13-year-old female presenting with her mother, Amy Chen, who consented to a private interview. Patient came in with chief complaint stating, "My stomach hurts and I get headaches. I feel tired a lot." Patient's history of present illness includes Veronica is a 13-year-old female presenting with recurrent abdominal pain, headaches, and fatigue. She states that abdominal pain occurs only when she is about to go to school and improves when she remains at home and on the weekends. Symptoms have been present for several years and are progressively worsening. During the interview, Veronica appears tearful and visibly distressed and reports ongoing bullying by a classmate. She endorses anticipatory anxiety before school, difficulty concentrating in class, frequent visits to the school nurse for physical symptoms. She denies recent illness, chronic medical conditions, substance use, hallucinations, suicidal ideation, or self-harm behaviors. As far as objective data goes, vital signs are blood pressure 110/70, pulse of 70 beats per minute, respiratory rate of 16, and temperature of 98 degrees Fahrenheit. Mental status examination includes a well-groomed adolescent, which is cooperative but anxious, normal speech, mood is stressed, constricted, tearful affect, logical thought process, no suicidal or homicidal ideation or psychosis. Patient is alert and oriented ×4, fear, insight, and judgment. As far as labs and diagnostic go, I would order a urinalysis to rule out any UTI, dehydration, or renal causes of her abdominal pain and fatigue. I would also order a urine drug screen, which can screen for undisclosed substance use affecting mood or somatic symptoms. I would also order a CBC, which would evaluate for any anemia or infection, which could be contributing to her headaches and fatigue. A CMP, which can also assess metabolic or electrolyte abnormalities, which can also contribute to her feeling unwell or dehydrated. I would also order a thyroid panel, which can identify a thyroid dysfunction, which can also mimic anxiety and depression. Suicide risk screening, as far as her history of getting bullied by a classmate, increases the risk required for adolescent mood symptoms. I would also order the GAD-7, which would measure anxiety severity and establishes baseline. A PHQ-9 for adolescents, screening for depressive symptoms and functional impact. Medical causes must be excluded and psychiatric severity quantified when adolescents present with stress-related somatic complaints. As far as assessment and differential diagnosis, I would include generalized anxiety disorder, somatic symptom disorder, social anxiety disorder, and adjustment disorder with anxiety. The definitive diagnosis I would choose for this patient would be adjustment disorder with anxiety, evidenced by emotional and physical symptoms directly linked to her chronic bullying history, contributing to stressors causing school impairment. As far as the plan goes, I would include psychotherapy as first line. And if symptoms persist, I would also consider fluoxetine, which is FDA approved for pediatric depression and commonly used for anxiety. As far as therapy and support, I would refer her to receive cognitive behavioral therapy, which can be very helpful for her in this situation. Family support and coping skills training. Parent to coordinate with school anti-bullying plan due to her long history of getting bullied by the classmate. I would encourage sleep hygiene, exercise, and relaxation techniques, since she also endures difficulty sleeping and fatigue. And then I would have her follow up and return in 4 weeks or sooner if symptoms worsen or safety concerns arise. Thank you.